Hey everyone, Brandon here from Trucksafe. Operating large commercial motor vehicles and those transporting a lot of passengers on public highways can be particularly dangerous. So it's really no surprise that there are regulations in place to ensure that drivers of these vehicles are properly qualified to do so. These regulations, which are promulgated by the Federal Motor Carrier Safety Administration and its state partners, include some minimum physical qualification standards, which are fairly detailed, and they're designed to ensure that drivers who have certain ailments and other medical conditions that could negatively impact their ability to safely operate a commercial motor vehicle are kept off the roadways. In this video, we're going to take a closer look at these physical standards and discuss the process that commercial drivers must go through to be eligible to operate commercial motor vehicles in commerce. So stay tuned and be sure to hit the like and subscribe buttons below to keep up to date on all of our new DOT-related content. So as it turns out, there's quite a bit that goes into ensuring commercial drivers are physically qualified to operate. So in this video, we're going to explore exactly what it means for a driver to be physically qualified to operate, and then we'll address how it is that drivers are deemed to be physically qualified by a DOT medical examiner and what evidence drivers must have to prove that they are in fact physically qualified. And then we'll wrap up with a look at some unique issues that can arise with respect to physical qualifications. So if we think about this conceptually, I think it's pretty clear why the FMCSA would want to ensure that commercial drivers are physically qualified to operate a commercial vehicle before they do so. I mean, the last thing anybody wants to do is place someone with a serious medical issue that has the potential of impairing his or her ability to safely operate a vehicle behind the wheel of an 80,000-pound tractor trailer. That's just asking for trouble. So the federal safety regulations contain a few sections that are specifically devoted to the minimum physical qualifications for commercial drivers. Drivers who don't meet these standards are not qualified to operate a commercial motor vehicle. Now, the list of physical qualifications is found in 49 CFR 391.41, and it's a fairly lengthy one. I don't think it really does any good for me to read that entire list. So what I'll do is scroll through the list on the screen and read a few of the more significant physical qualifications. Obviously, feel free to pause the video at any time to take a closer look at these requirements. So section 391.41 says that a driver is physically qualified to drive a commercial vehicle if that person has no loss of a foot, a leg, a hand, or an arm, or has been granted a skills performance evaluation certificate, which we'll discuss a little later. Other examples of physical qualifications on this list are that drivers must have no established medical history or clinical diagnosis of insulin-treated diabetes or certain heart condition. Additionally, drivers must have a visual acuity of at least 20/40 in each eye, with or without corrective lenses, and a field of vision of at least 70 degrees in each eye. They must be able to perceive a forced whisper in their better ear and not less than 5 feet, with or without the use of a hearing aid. They must also not use any Schedule I drug, amphetamine, narcotic, or other habit-forming drug, or any non-Schedule I drug, except when the use is prescribed by a licensed doctor who's familiar with the driver's medical history and has advised that the substance will not adversely affect the driver's ability to safely operate a commercial vehicle. And lastly, a driver must have no current clinical diagnosis of alcoholism. So the obvious question is, how is it that motor carriers, assuming they have no doctors on staff, confirm that their drivers meet these physical qualifications? Well, the FMCSA's regulations specify that commercial drivers must be medically certified to meet these minimum standards by a medical examiner who is knowledgeable of the specific physical and mental demands associated with operating commercial vehicles, as well as these regulatory standards. In other words, commercial drivers must undergo DOT medical exams administered by a medical examiner who's listed on the FMCSA's National Registry of Certified Medical Examiners. These medical exams must occur at least every 2 years for each driver. And during the exams, the medical examiner performs the evaluation and documents the results on Form MCSA 5875, which is sometimes called a long-form physical examination form. If after the exam, the medical examiner determines that the driver meets the minimum standards, he or she will issue that driver a medical examiner certificate, also called a med card. And that med card serves as proof that the driver meets those minimum standards. These cards are valid for a time period prescribed by the examiner, but not to exceed 2 years. Some medical conditions will cause the examiner to issue a card that's valid for less than 2 years. For example, some drivers with heart conditions will be issued a 1-year card or a 6-month card or even a 3-month card, meaning that they have to come in for more frequent examinations. In any event, drivers must provide a copy of the medical card to their carrier and should also keep a copy with them while operating. In addition, for CDL drivers specifically, they must provide evidence of their updated medical cards to their state licensing agency, and information about that exam will be included in his or her CDL driving record. Further, carriers that engage or employ CDL drivers must take the extra step of running a new motor vehicle report within 15 days after a CDL driver obtains a new med card, in order to ensure that the new med card details have been uploaded to the state system. If they haven't, in other words, if a CDL driver's med card expires and the state hasn't uploaded information about the renewed card, then the state will take action to downgrade the CDL holder's license, which would obviously cause problems. So the point of this extra step for carriers that engage CDL drivers is so that they can ensure that a driver's CDL hasn't been downgraded for failing to present the new medical card information to the state licensing agency. This is a key thing to remember because I've seen FMCSA investigators write this up as a violation in several audits. So the takeaway here is that drivers must be physically examined by a certified medical examiner and must timely renew their medical cards. For their part, carriers must ensure that a driver has a valid medical card and must carefully track the expirations of those cards and ensure that drivers timely renew them. So we're going to wrap things up by taking a brief look at some special cases, the first of which are insulin-dependent diabetic drivers. Recall that under the FMCSA's minimum physical qualification standards, a driver is not normally physically qualified to operate if he or she has a clinical diagnosis of insulin-treated diabetes. However, understanding that this is a fairly common medical condition, the FMCSA's regulations actually set up a system where insulin-dependent diabetic drivers can in fact become qualified to operate a commercial motor vehicle. They just have to jump through some extra hoops to do so. Specifically, an insulin-dependent driver must undergo a special assessment from a DOT medical examiner who must receive documentation from that driver's treating physician concerning the driver's medical treatment for diabetes and attesting to the fact that the driver has a stable insulin regimen and properly controlled diabetes. If the DOT medical examiner is satisfied that the driver can safely operate a commercial vehicle, he or she will issue a special assessment form along with the med card and will require that driver to submit to new DOT medical exams at least once every 12 months. Another special case has to do with drivers with certain impairments that could otherwise render them unqualified under the FMCSA's physical standards. For example, drivers with impaired hearing or vision that would normally prevent them from obtaining a med card can apply for a special exemption or waiver from the minimum hearing or vision standards with the FMCSA. Now, this exemption process requires drivers to complete a detailed application, complete with information about their medical history and driving history. For its part, the FMCSA reviews these applications and must determine whether, in its estimation, these drivers are capable of maintaining a level of safety that is equivalent to or greater than the level achieved without the exemption. If so, the agency will grant the exemption, and the driver will be cleared to obtain a med card in order to operate a commercial vehicle. Lastly, for drivers with missing or impaired limbs, the FMCSA has a program in place called the Skills Performance Evaluation Certificate Program, or SPE program for short. The program allows drivers to become qualified to operate a commercial vehicle if they've been fitted with and are wearing the right prosthetic device. The driver can demonstrate the ability to safely operate by completing on and off road activities. If the driver passes the driving test, he or she will receive an SPE certificate and will be cleared to operate so long as they are otherwise qualified. So that's going to wrap things up for this video. For even more in-depth information about the driver qualification process and other major aspects of the federal and state safety regulations, be sure to check out our innovative online compliance courses for safety managers and drivers over at trucksafeacademy.com. Also, be sure to check out our detailed compliance articles on our website at trucksafeconsulting.com and follow us on our various social media pages for the latest highway transportation news and analysis. Thanks for watching.